This can be an awkward method, however, the idea is typically the same as a canine. It's just securing the head that can become difficult. You may need to scruff the cat. You may be able to just place hands under the jaw to keep the cat from moving and try to keep from biting. You want to extend the forelimb as you did with the dog, placing a hand behind the elbow and rolling off that vein laterally with your thumb. Where you have to use your nail and not your finger. This patient is being spayed today, so she has received a pre-med. The technician is about to place an IV catheter. The occlusion of the vessel is the same restraint method as cephalic venipuncture.
Don't tape me getting the catheter not in.
I will stop it, okay, if I can. And here it goes. Sorry. Sorry.
As my hands are bloody too. And then
For feline femoral venipuncture, begin by scruffing the cat and laying the cat in lateral recumbency. Secure the top hind leg and tail in your free hand and use that hand to karate chop the hind leg and occlude the vessel.
let's hope you can go get stayed.
Your deposit is in.
Oh, thank you.
You're welcome.
When muzzling a dog, I found that it's typically easiest to stand or squat behind the animal. For a gauze muzzle, make sure you have your knot tied at the top first. Loop the circle around the dog's mouth and cross it underneath the jaw. Pull it up behind the ears and tie it in a bow behind the head. It may be necessary to have someone else helping you hold the animal still. Seamus here was very good and didn't really need to be muzzled. He just got lucky and was my guinea pig. For a nylon muzzle, you want to make sure you've got both ends towards the end of the strap so that you have plenty of space to tighten down as far as possible on the muzzle. So once you have that muzzle on properly, you can clip it and tighten it down as necessary.
Thank you.
Muzzling a cat is the same basic idea. Stand behind the animal or ask for help if you need it. Place the cat's face into the mask and fasten the Velcro behind the cat's head.
No.
The first step to applying an e-collar to a patient is choosing the correct one. We have comfy cones and plastic e-collars for dogs, and we have soft glue ones as well as the other options for cats. When choosing the correct e-collar, you want to find which one fits both ways best in length and around the girth of the neck. You want to be able to fit a few fingers underneath the neck part of the e-collar, and you should not be able to yank the collar off as if the dog were trying to scratch it off. You should not also be able to allow the dog's nose past the edge of the e-collar in any direction that he or she may turn.
This
Done?
Moving on to some basic assessment. We're using a cat today. First is temperature. Use a digital thermometer Apply a generous amount of lubrication, locate the anus, and insert gently but deeply as possible to get closest to the core temperature of the animal. These digital thermometers typically beep when they're finished, or if they don't seem to be working very well, you can watch to see just where it seems to be leveling off.
Shelter right? There's a little handout. 102. 102. That's good. That is good.
The femoral pulse is best felt on the medial hind limb near the inguinal area. Use your fingers and not your thumb to feel this because your thumb does not have as much sensitivity as your fingertips. The heart rate can be assessed in conjunction with the pulse in order to determine if there is a pulse deficit. Locate the heart on the chest wall, just caudal to the elbow using your stethoscope, and count lub-dubs for about 10 to 15 seconds, then multiply by 6 or 4 respectively. Respiration is counted the same as heart rate for 10 to 15 seconds. Every inhalation and exhalation is one respiration. You can feel the sides of the body or watch the body move in and out in order to count respiration. Mucous membrane color and capillary refill time are typically assessed by looking at the patient's gums and assessing the color, and then pressing in order to blanch white the gums and counting how many seconds it takes for the color to return to that spot. To assess hydration, pinch a tent between the patient's shoulder blades. The faster the skin snaps back to its original position, the more hydrated the patient is.
Okay, she's a little bit.
To confirm gender, look for a vaginal opening just below the anus. If that is not present, or testicles or a penis are, you know you have a male and not a female. Microchips are usually placed between the shoulder blades or along the spine. Medicating small animals can be very difficult, especially with cats. Your best case scenario is a dog that will eat a pill or capsule in a piece of food or a pill pocket without any issue. Otherwise, if you have to force the animal to take the medication, you can use one hand to grab the top of the muzzle and the other to lower the jaw. Place the capsule or tablet between your thumb and forefinger and place it as far back on the tongue as possible. Quickly close the mouth, keeping the nose pointed forward, and allow the patient to swallow the pill. Liquids can be a little more difficult. For dogs, you can place the liquid in the syringe and squirt it slowly into the cheek so that the dog has time to swallow and does not aspirate. Ear medication always requires cleaning of the ear.